So we're here with Dr. Brian Flynn, expert in reconstructive urological surgery, and he's a great mentor, great teacher, and great surgeon. Also one of my best friends, and I'd like to thank you so much for being here, Brian. You are part of this family and you are part of the scientific board. Let's talk a little bit about Brian Flynn, the man, and you're a great family, man. So we talk about burnout, we talk about how people get stressed out and how that influences patient safety. Tell me a little bit about how you manage your time, how you prevent burnout in your life.
Thanks, Fernando, and what an incredible honor to be here in Jackson Hole with you at this meeting. This is the best urology meeting in the country. No offense to anybody else, but this meeting's been going on for 39 years, and you don't have a meeting for 39 years unless you have a culture of family, and families stay together, and the best families are successful together. And that's the legacy that Ralph Hopkins started and that you've been able to continue. I'm so blessed to be on this educational board with you, and I really enjoy having the opportunity to help develop the program and some of the content. I'm a family guy, as you mentioned. I grew up one of 5 siblings, and I have 3 brothers and a sister. I grew up in a small town in central Pennsylvania. And so I understood family at a very young age. Being the middle child, I was always kind of the arbitrator in my family, the peacekeeper, to try to keep the peace amongst my brothers especially. When I left Pennsylvania, I went to college in Rochester, New York. I went to medical school at Temple University. Did my residency at Geisinger Clinic in Central PA, and then did my fellowship at Duke University. I went to University of Colorado in 2002, where you and I first met, and we became instant friends because you were coming back from your fellowship at around the same time. And there's always that interesting bond when new people start together. So we really started together in a lot of ways, and you were very helpful in getting my career started and getting me involved in understanding family. You know, and that's how this meeting runs. That's how this program runs. And certainly in families, we're not afraid to have hard conversations with each other. And we have to do that. If we're going to try to develop a culture of safety, for instance, the first thing is being open, being honest, and being transparent. Right. That's going to create safety. You've developed this wonderful meeting. Similarly, if someone wants to develop a new part of the program, we're all going to be interested in looking at that and trying to develop and cultivate that. And that's how this meeting runs. What I'm so impressed about is just seeing the same people in that audience every year, the repeat attendees. It's just tremendous. I was having a conversation with Dr. Terry Scott a couple nights ago, and he gave me the long history of the meeting, and he has attended every single Jackson Hole Urology Seminar. I don't know too many other meetings that do something like that.
So, but you run, that's how you relax, and what else you do? You like music? I know you go to outdoors events all the time with your family.
Yeah, I think in order to stay burned out, you have to keep your focus and you have to have a balanced lifestyle. In Colorado, we like to say we work hard. Okay, we see a lot of patients, we publish, we travel, we go to meetings, but we play hard. And when I play hard, I'm usually playing with my family. I like to ski in the wintertime. Summertime, I like to run and bike. Recently, my wife recruited me into the CrossFit Mafia, and I've been doing that with her for the past 2 years. And I like to spend time with my friends. And so when I'm doing things socially, it's with friends. When I'm doing things regarding fitness, it's with friends and family. And I think fitness is a great way, a productive way to decompress. I mean, there's a lot of things people do in order to try to relax after work, and some of them are not so productive. And I find either a good workout after a really tough day at work helps me decompress before I walk in that door. And at that point, all those stressors from the day are now out of my system, and I can enjoy the evening better, with my family.
Yeah, you have a beautiful house and a very special place. Let me ask you, this is what I ask also Adam Kaival. You have grown-up children. They went to school, to college, and now you have also someone that is going to college. What is the advice you give to all your kids?
Well, the advice I give to my kids and I give to my friends who are raising kids is get your kids involved in as many things as you can. I bring my kids to this meeting, right? What incredible opportunities for them to observe, okay, to see how relationships develop professionally and how they become, personal relationships and lifelong friendships. I bring them to dinner, right? Your kids are not going to know how to behave at dinner unless they've been at one of these before. And, those are just little things that I do. But, I'm a quiet leader. I try to lead by example. I'm not real showy. I'm not real loud. So, I don't expect anything from my kids that I wouldn't expect from myself or from my wife. I don't ask them to do things that I wouldn't personally do. And, those things have been helpful. But I think, remember the old saying, birds of a feather flock together. So I try to make sure my kids are in the right crowd with the right people, developing the right friendships. And you mentioned mentors earlier, and really trying to connect my kids with some early mentors. Yeah. Okay, and my oldest son wants to become an engineer. So what's the first thing I did? Try to find some engineers in my neighborhood that maybe he can meet. Sit down like this, have a conversation, right? And find out if that's something truly that he'd want to do. Understand the profession better. Maybe go to work with someone. Shadow them a little bit. When there's a professional that comes into your school, go to those talks. Listen to those folks. Take advantage of those opportunities. And the networking, right? The networking starts at a very young age. It starts in high school. It develops in college in the different alumni associations. And just having that networking piece. When you come to a meeting like this, what incredible opportunities to network, right? I have friends all over the country and all over the world. So if I have a family member who calls me and says, hey, I have a brother who has lung cancer, I don't know what to do. First thing I do is I email Rob Uzzo, who's the chair here of the educational panel this year, and the Department of Surgery chair at Fox Chase Cancer Center. I wouldn't know Rob Uzzo if it wasn't for this meeting. When my family member called me and says, what do I do? Who do I send the person to? I'm not sure where I'd begin. Right. But the rich network of friends that we develop through this meeting is so important. So I try to emphasize to the kids the networking and then the mentoring.
All right. This is so helpful, I think, for anybody. Starting fellowship, residency, and even for kids going to college. I think this is very important. And Amy is your
my rock.
Your rock.
She's my rock.
And
yes.
I think that is an important part of your life. I know that. How do you define her role in your profession?
In my profession, well, I mean, Amy's been my life partner. I met her when I was 21 years old, okay? And so I've been together, for such a very long time that she's been through the highs and lows of this with me, through the training, and through the down times, through the 100-hour work weeks before there was an 80-hour work week. She's had to sacrifice with me, when I missed out on different social opportunities during training because I was trying to prepare for my in-service the next day or trying to finish a paper or try to prepare for an interview. She understood, she always saw the big picture, and I think it's important to communicate with your spouse. Here's my 5-year plan, here's my 10-year plan, and developing that plan together and saying, what's really important to you, and trying to find some compromises. And for me, it was important to become a reconstructive urologist and be busy right from the very beginning. Once we made that decision and she was supportive of that, we started talking about where we wanted to live. And so then she had some great ideas regarding that. And so then the conversation just develops. And it's a give and take in any relationship, with a partner. And there's things that are maybe more important to one partner versus the other, and just trying to find that balance and trying to be an equal partner. If a relationship's not equal, it's not sustainable.
Yeah.
And so the relationships have to be equal and they have to be mutually beneficial.
This is very important, and I'd like to thank you again for you to take time, invest your time here in this meeting, and allowing us to continue with the Ralph Hopkins legacy. Thank you.
Thanks so much, Fernando. Wonderful to be here.
Thank you.